Surgery unit of the Korle Bu Teaching Hospital. This morning, she joins us on a conversation on breast cancer. Good morning, Doc. How are you?
Good morning. I'm good, thank you.
You look very, very nice, and I like your smile. Welcome to our show.
Thank you. Happy to be here.
Yes, we're happy to have you, to give us all the juice. How's your weekend?
Good.
Yeah? Were you in hospital?
Is cancer. So unless you get it checked out, you wouldn't know. Okay. I mean, the common one everybody knows about is a lump. So yes, a lump could be a sign of breast cancer, but not all lumps are cancerous.
Okay.
You could have some unusual nipple discharge. It's common to have a little whitish, yellowish fluid from your nipple. That's all right.
Okay.
But where it's a lot or it's bloody, then you should be concerned. You should get that checked out. Okay. Just a tiny little rash or a sore on your nipple could actually be a sign of breast cancer.
A rash?
Yeah.
Okay.
The breast could swell or have dimples on it. That shouldn't be there. And then sometimes there may be nothing in your breast at all, and you rather will find a lump in your armpit. That also could be a sign of breast cancer.
Okay.
But honestly, I think we should even be moving away from that. We need to detect breast cancer before those symptoms appear.
Okay, yeah.
Before those symptoms appear. There's nothing wrong with your breast. You don't feel anything wrong with your breast. But because you go and do breast screening, we can actually diagnose breast cancer before you feel a lump or any symptom. And that's really the best.
Okay. So I'm going back to the rash. So would this have a color? Would it come in a certain pattern?
Yeah, it could just be a really tiny sore, not even a centimeter. The nipple suddenly looks red or dry and scaly. You think it's just an ordinary rash, but it's not. And that could be a sign of early breast cancer.
Okay. And for finding lumps or stuff in the armpits, is that very common?
Well, the lump in the breast obviously is more common.
Yeah.
But every now and then, some people do not have anything in their breast, and they present with a lump in the armpit. And we see it's not uncommonly, actually. We do have quite a few of such cases.
Okay. So what are the risk factors that lead to all of this?
Okay. So, unfortunately, just being born a woman is enough reason to get breast cancer.
How sad.
Yes. There isn't much you can do about that.
Right.
But that is the greatest risk factor, being a woman. And then, you know, every year when you are getting on in years, you are aging, the body undergoes wear and tear. And, you know, our breast is exposed to a lot of hormonal changes and cycles. You know, we keep menstruating and all those things. So as we are aging, gradually, the chance of getting breast cancer also increases. I know a lot of people will say, oh, well, I don't have breast cancer in my family. Truly, there are the hereditary types, the ones that are genetic, but they are only about 10%. So that means 90% of people don't have it in the family. Nobody has ever had breast cancer, and it would be the first time. Yeah, so the other risk factors all have to do with being a woman, really. You know, it's the hormonal changes. So those, maybe you start menstruating at 9 and then you go into menopause, let's say 55. All those years of being bombarded with the hormones actually does increase your risk a bit, but you can't change it. You know. That is why we may want to focus on the risk factors that you can do something about. So that's basically the healthy lifestyle we keep talking about. So, you know, you want to check your weight. You know, obesity is not a good thing. Brings on all sorts of diseases, not only cancer. Especially after menopause, it can increase your risk for breast cancer. You want to check your diet. Fruits and vegetables contain what we call antioxidants. So these antioxidants are able to mop up little chemicals in our body, which we call carcinogens, which can over time cause breast cancer. So more fruits and vegetables. You know, cut down on the fatty meals and then exercise. So some brisk walking 3-5 times a week, that would be great. And then, breastfeeding. We shouldn't forget about that. Breastfeeding actually reduces your risk of breast cancer. It you know, it breaks those menstrual cycles, and it resets the female hormones I was talking about. So breastfeeding is good. If you can breastfeed a baby up to 2 years, that's great.
Oh, wow.
I mean, having said that, you can do everything and still get breast cancer.
So what if you have more children, it reduces your risk further then?
It does.
Okay.
It does. But then, you know, it's not a guarantee. We see people who've had 5, 6 children and still get breast cancer. Yeah.
Okay. You mentioned, so from the moment the period you start menstruating, so this is if a child begins from like 9, what's the youngest age a female has been diagnosed with breast cancer? Do you know?
Well, we have to check the literature. I think I have heard of 16, but the youngest patient I have had is 18.
18?
Yes. I mean, for the age distribution, commonly in Ghana, the commonest age group are women in their 40s.
Yeah.
But we see it right from the age of 20. There are a few cases in their 20s, a good number in their 30s, and between 40 and 50 we have a whole lot. And then after 52 we have quite a few.
Right. If for those that for the genetic ones, right? How do you don't have a choice, do you? So for you have to just what? Screen. What happens?
Yeah. So to actually say it's genetic, you should have a significant family history, a close relative, maybe a mother, a sister, a father, someone that close had breast cancer. But also there may be other types of cancers in the family, you know, stomach cancer, pancreatic, gastric, all these could be that troublesome gene appearing as different cancers within the family. So really, you should actually test for that gene to see if you have that gene. There are a whole lot of genes actually. But once the conclusion is you have the genetic type, then yes, you have to do, you know, a very close follow-up with your breast screening. Everybody may have to do a mammogram every 2 years. You would probably have to do yours every year, and in between you do some scans, you do MRIs. But it's not just screening. There are options to actually prevent you from getting breast cancer. So for instance, you may even want to consider removing both your breasts and having breast reconstruction. But we need to talk to you, we need to understand, and then at a time, you know, you speak to our clinical psychologist. At a time we feel that you are ready, then we can do this big surgery and then do breast reconstruction to help you, you know, build up your confidence.
Is this common? Getting all your 2 breasts out, is this common? How do patients receive this news?
Oh, we do that quite often. Some people don't even have the genetic type, but when you talk to them, for a number of personal reasons, they prefer that instead of removing one breast, like they have breast cancer in one, for a number of personal reasons, they will insist that you remove both breasts. I don't necessarily recommend it for everyone. If you have the genetic one, definitely we recommend that you do so before you get breast cancer. But when we do remove their 2 breasts, you know, we talk to them, they see our clinical psychologist, and the patient themselves wants it, so they are all psyched. And they are happy with it. And then we do the breast reconstruction. You don't have to go flat. So you get breast reconstruction, you build up your body image and your confidence, and they do quite well with it actually.
Is this procedure, is it done here in Korle Bu?
Oh, yes.
Oh, wow.
Yes, we do it all the time in Korle Bu. So I'm a general surgeon, so that means I deal with the removing the breast part. So I collaborate with my colleague plastic surgeons. And it's one surgery, we coordinate it, you know, as we are working.
Everybody's working at once.
So you go to sleep, you wake up and you have a new breast.
Ideally, how long does it take?
It will take a few hours, maybe about 4, at most 6 hours, depending on the technique.
Okay, so you go to bed technically with cancer in one boob, and then you wake up cancer-free with new boobies.
Yes.
Is this procedure expensive? Is it available to, say, somebody in a far-to-reach area?
The procedure is available at Korle Bu, at Komfo Anokye as well, or wherever you have a plastic surgeon. It should definitely cost a bit more than just removing one breast, because there's extra anesthesia time, extra drugs. If we are using an implant, the implant has to be paid for. But these are not done as cosmetic procedures. They are done as rehabilitative surgeries.
Okay.
You know, a cosmetic procedure would be expensive. This one, though it's more expensive than just removing a breast going flat, it's going to cover the basic costs.
Okay.
And the intention is rehabilitative. It's not cosmetic per se.
Okay. So how many of those surgeries have you and your team performed this year? Can you tell off the top of your head?
This year, maybe not bilateral, but maybe looking at bilateral and then one-sided. Sometimes we do reconstruction on one side and leave a normal breast. Maybe at least 10 to 20, something like that, yeah.
Okay, and this is in Korle Bu. So
yes.
maybe in the other hospitals as well they've
yes,
done.
I'm quite sure they've done it.
Oh, wow, this is great.
Yeah.
Okay,
so it's very available.
Okay, so let's go back to the youngest patient you had, who was 18. Was hers genetic?
I think she had, is it a mother or mother sister who had breast cancer before? But we didn't do the genetic test.
Okay.
So it could be genetic. I cannot say for a fact. I mean, it was just a sad case. She came in when it was really, really advanced. You know, they tried all sorts of herbs. It was a big sore fixed to her chest. It had already spread, and it didn't end well.
Oh.
I mean, she came in too late.
Okay.
But we have young patients who survived. I had one last year, 22-year-old student in university, lovely girl, very confident. She came, and hers wasn't genetic, but she insisted on having both breasts removed. She did so. She's been through all her treatment, chemotherapy, radiation, everything. She's really fine, back to her usual life. So it doesn't always end badly with death. It really depends on the stage at which you show up. That's why we keep talking about early detection, you know, through breast screening, screening, and that's the best.
Okay. So you mentioned herbs with your patient. Is that a common thing where
way too common?
Ghanaians still
way too
tell us
common.
About it. What's
way
happening with herbs
common.
and cancer?
It's 2025. It's just a bit too much, you know. So a lot of people will admit that they try some herbs or some form of alternative treatment.
Okay, yeah.
They'll try everything. When it's not working, then they appear at hospital. You know, early breast cancer is curable. Advanced breast cancer is not, you know. But we waste time dabbling in all sorts of things. Some of the medication, they drink it. Some they apply it, enema it, all sorts, you know, plus the prayers, and the rolling on the beach, and you know,
rolling on the beach. No, please tell us about that dog. I haven't heard that. That's new.
Yes.
Rolling on the beach. What do they do?
Well, some say that you have some special rituals or prayers at the beach and seawater and all that. You know,
a ritual bath.
Yes, a ritual bath, and it doesn't work. You know, I haven't seen one case that has worked. I can only speak about what I have seen.
Okay.
Some people will say it cures, but so far all I know is most patients will come and admit, I used this, I used this, I used it. It didn't work, and they come and it is too late. So if you ask me, those alternative treatments do not work. But the medication we use at hospital are well researched, tried and tested, you know, developed elsewhere actually. Okay, yeah. And we use these, and we have a good number of patients who have come with early breast cancer, and they've received their cure right here in Ghana. Okay. We have everything it takes to cure early breast cancer. And so if you look at the data, you'll see that anyone with stage 1 breast cancer here, the survival rate is over 90%. And the survival rate for stage 1 breast cancer in the United States is the same, over 90%. But the overall survival rate here in Ghana is less than 50%, because most patients have the advanced breast cancer. Yeah, and then when you look at the survival rate in the US, it's almost I think it's like 80 to 90% the overall survivor. But the difference is the proportion of advanced disease that we have. That spoils the statistics.
Right.
But if you're able to tease out those with early breast cancer, you see that, yes.
Right. Okay. You mentioned stage 1. Briefly run us through the stages. Well, stage 1, stage 2, and what is stage 1, what is stage 2?
Okay. So commonly you hear of stage 1 to 4 breast cancer. And actually there's even stage 0 breast cancer.
Okay.
Yes.
Okay, tell us.
So stage 0 breast cancer is the one that you go and do your breast screening, i.e. you're going to do a mammogram.
Okay.
So the recommendation is from the age of 40, you should be doing a mammogram. Every couple of years, every 2 years, ideally, you should do a mammogram. Okay. Now, when you do the mammogram is able to pick up some tiny little breast cancer, about 1 or 2 millimeters. And you're not going to feel a 2 millimeter lump in your breast. The lump is going to be about at least 1 or 2 centimeters before, if you are a very careful person, you pay attention to your breast before you notice it.
Right.
Yeah. And Ghana, most people will come with a lump that is more than 5 centimeters. They've now noticed it. But if you do your mammograms, it picks it up before it becomes a lump or anything. So that is the stage 0 breast cancer. And at that stage, it's pre-invasive. It's in a form that cannot spread. So when we get stage 0 breast cancer, we can treat it without even doing anything fancy like chemotherapy.
Okay.
So it's we could even just remove that lump. You leave your breast. We might put you on some hormonal tablets or so, but it's likely you may not even need chemotherapy.
That's stage 0.
Yes, that's stage 0. Okay. Then we have stage 1 cancer. The cancer is up to 2 centimeters. And it hasn't spread to your armpit. There are some nodes in your armpit. From the breast, cancer goes to the armpit. Okay. Stage 2 is a little bigger. Let's say more than 2 to 5 centimeters. And then hopefully hasn't spread to your armpit. Yeah. If there's spread, maybe just one tiny little lymph node. Okay. But stage 3, it's spread from the breast, and a good number of lymph nodes in your armpit are involved. And once it's reached your armpit, you know that it goes into your bloodstream, into your body, and can get to your brain, your lungs, your bone, liver, and that is the stage 4, and that's the last stage. So gradually it chews up, cells in your body, and then you see that the person becomes ill, and unfortunately that is what will lead to the demise of the patient.
Okay. Yeah. Tell us about vaccines when it comes to breast cancer.
Okay, so at the moment there isn't a commercially available vaccine for preventing or treating breast cancer. But we do know that there's been a lot of work and research, not in Ghana, but a lot of work and research going on with vaccines.
Right.
And it looks promising. You know how vaccines work, whether it's for COVID or hepatitis. What vaccines do is they stimulate your body so that your body's own immune system can fight the disease. So I can't give any specific examples, but there's some new discoveries which I think they are being tested to see whether they can boost your body's immune system to be able to fight cancer.
Right. So in creating awareness, mention how people still use herbs and all of those things. Does it mean that all the awareness and all the noise we are making, it's not getting into people's heads, or people are just not listening?
I wouldn't say it's the awareness creation is not producing results. Okay. If we look 5-10 years back from now, I think there has been some improvement, honestly speaking.
Okay, great.
Not enough, but now we are actually seeing screen-detected cancers. Okay. 10 years ago, we were not. Everybody came with a big lump. Okay. So we are having a good number. So, for instance, breast-conserving surgeries, where we just remove the cancerous lump. I think we are doing at least 20%. But 5-10 years ago, we were not even doing
that much.
Yeah, half of that. And everybody had to remove the whole breast. So it is catching on. And you'll be there even without advertising. Women just walk into the clinic, oh, I want to have my breast examined. People are now being more
vocal,
health conscious, breast aware, but it's not enough. And also I think we're probably concentrating our efforts within the big cities. So really it needs to go all the way down, you know, to every single village. Every woman should be aware. You will see a lot of advanced disease coming from, you know, the villages.
But rural, actually, very rural areas.
Yes, but actually a lot too from Accra.
Cities.
Yeah. You come and some PhD holder or even medical personnel. We also Ghanaian, so we also have spiritual thoughts. If you know what I mean.
You don't say.
Oh yeah, you can see a doctor or a nurse who is dabbling in something herbal or praying because it's, you know, the grandmother or, you know, the neighbor I was fighting with who is doing me and all those things. So we want to satisfy those ones before we come for the hospital
medical one.
Yeah. So you realize sometimes it's not even about education. It's just about how superstitious we are or how religious we are as a people. But you know, when the pastors are not well, they come to hospital.
What an irony.
Yeah.
And then when we are ill, we go to the pastors to pray for us.
But now also a lot of churches are coming on board with their awareness creation. And as a society, the Breast Society of Ghana, we've done a lot of work and they've attended our programs and education. So a lot of churches are really receiving the message. They are coming on board. Within churches, this October, we are having breast screening. You asked me what I was up to this weekend. Yeah. So actually now, a lot of people are changing their mind.
That's great.
And we're hoping that 5-10 years now, the statistics will be different.
No one will be saying, I'm listening to my pastor. My pastor says I shouldn't go to the hospital. Come for prayers. This has been a great chat. Your final words, wrapping up, perhaps telling us activities that is happening this weekend. I mean, this week.
I mean, so throughout the month, we're continuing with our media engagements, awareness. We have daily breast cancer messages we're putting out on our social media platforms. This week Wednesday at 5 p.m. we will be having an online public lecture. If you check our Facebook, Instagram pages, the adverts are there. So there will be a link. Anybody and everybody should join in, and we're going to be talking about modifying your modifiable breast cancer risk factors.
Say that again. I will not attempt to say it. You say it.
Modifying your modifiable risk factors for breast cancer. So that's what we'll be talking about. And we will crown the month with a massive awareness walk on Saturday, 25th of October. That will be at 6:30 a.m. We will start and end at Elwak Stadium. So we want everybody to come on board. Come out in your pink. Join us. Let's make some noise and then let's save lives.
Thank you so much for the good work you're doing, Doctor. We've been having a conversation on breast cancer awareness. Catch it early, treat it right, survive it. Our guest in studio has been Dr. Josephine Nsafo. She's president, Breast Society of Ghana, and then she's a general surgeon at the breast surgery unit of the Korle Bu Teaching Hospital. She has been our guest on the clinic. We'll take a break. When we return, we have the exclusive. The champions are in studio. UDS is in the house. We have champions in the studio, guys. Stay tuned. We'll see you after this break.